Namaste. Good evening, good afternoon, good morning, friends, and a very warm welcome to all of you to this extremely important session on the role of media in exposing, debunking, and countering lies and deceptions of the deadly tobacco industry. This session is being jointly organized by Asia Pacific Cities Alliance for Health and Development, or APCAT as we know it, Corporate Accountability Network for Accountability of Tobacco Transnationals, that is NAT, Corporate Accountability and Public Participation Africa, CAPA, Asia Pacific Media Alliance for Health and Development, APCAT Media, Global AMR Media Alliance, GAMA, Health TV Online Nepal, and Citizen News Service, CNS. The United Nations Health Agency, that is the World Health Organization, released its latest report yesterday on the tobacco epidemic. It clearly states that tobacco industry interference remains one of the greatest threats to the adoption, implementation, and enforcement of effective tobacco control measures. WHO Director General Dr. Tedros says in this report that countries must ensure that tobacco control policies remain robust in the face of tobacco industry interference. Tobacco industry, which now also manufactures and sells new nicotine products such as e-cigarettes and nicotine pouches, has a long history of opposing and obstructing public health efforts to protect people from tobacco. See a few of the tactics how tobacco industry lies and deceives us, derails, delays, and waters down life-saving tobacco control policies and their implementation. You can see some of the tactics on the screen. Also, this report documents how tobacco industry interference in public policy, lies and deceptions have marred public health for more than a century. As we know, the World Conference on Tobacco Control is currently being held in Ireland, and the next global intergovernmental meeting of the legally binding Global Tobacco Treaty, or WHO FCTC as we call it, that will take place in November 2025. That is the 11th COP. That will be taking place in November. As we know, WHO FCTC is the first legally binding corporate accountability and public health treaty of the WHO. But many of us might not be aware that a so-called Technovation Summit was hosted by Philip Morris International in Cape Town, South Africa recently during June 10 to 14. PMI, as we call Philip Morris International, it flew journalists to Cape Town and misled them with lies, junk science, and deceptive tactics to try to clean its image and wash blood from its hands. Some of the lies it churned out included harm reduction and e-cigarettes in the context of Tobacco Bill of South Africa. Another falsehood was the promise of PMI of reducing cigarette sales and working towards a smoke-free future. But it did not tell the media that it is rapidly expanding its acquisitions of e-cigarettes and vaping industry. It hid the fact that its products are causing epidemic proportion of diseases and untimely deaths every year. This summit resulted in a lot of misleading media coverage also in publications across Africa. Some quick housekeeping announcements before we begin. Participants, you may please type in your queries and comments in the chat box as the session progresses. We will take up relevant questions at the end of the discussion. Without any further ado, I now invite our panelists to lift the veil of deception from the face of big tobacco and expose their true colors and debunk the lies and junk science of tobacco industry. I now hand over the mic to our noted end tobacco advocate, journalist, and change maker, Akinbode Matthew Olubafemi. He is Director of Corporate Accountability and Public Participation Africa, that is CAPA. Welcome, Bode. We lovingly call him Bode only. So welcome, Bode, over to you.
Well, thank you so much, Shoba, and thanks everyone for joining this webinar. I think Shoba has put this in context, and I will further just make some very clear statements about the technovations that PMI organized in South Africa. So the first question would be, why South Africa? The South African government currently are ramping up activities to amend the Tobacco Control Act that was passed in 1993, close to 2 decades ago. And so before the South African Parliament Portfolio Committee on Health is the South African Tobacco Products and Electronic Delivery Systems Control Bill. And so Philip Morris was very strategic in bringing journalists from South Africa and others from the African continent to have this meeting at a point when attention was supposed to be focused on this bill by South Africa that is going to strengthen their over 2 decades-year-old bill. Let me also say this about South Africa. When we started tobacco control, we used to refer to South African law as, one of the leading lights on the continent. However, that law over the years has become dated and cannot respond to some of the emerging challenges of tobacco control, like those emerging and what we call novel products. It's now asking for a total ban of point of sales. That law was also looking for 100% smoke-free policy, which the tobacco industry does not want. Now, one of the key reasons why that was done was to again further what we all know as the industry strategy of delaying laws. So it is to shift attention from this very important law that was supposed to be passed by Parliament into these debates about harmful products or not harmful products. Additionally, it is also to dilute that debate. We know the delay and the dilute. And what was what were they trying to bring out? To say, look, this is a different product. We have new scientific evidence, and tobacco control advocates are not listening to the new scientific evidence. So tobacco should be removed. I mean, emerging products, or what they call nicotine delivery products, should be removed from the tobacco control bill. But let me ask a very simple question. Cigarette in itself is a nicotine dispensing mechanism. And so whether you are talking about the electronic nicotine delivery system, which is basically you move to, you having electronic products to deliver them, or if you're talking about heated tobacco products, you're still talking about nicotine delivery system. They advertise these products as less harmful products. Now, smoking rates among African youths are still fairly low. We know what these products have caused in the US, in France, even Sweden, example that they used to cite. But must we be exposed to harm at all when you have also just acknowledged that, quote and unquote, they are less harmful? However, scientific evidence has shown that these products are not as less harmful as they are being promoted by the industry. There has been an epidemic of vaping products in several countries across the world. And one of the key questions that we always want journalists to ask is, are these products leading to reduction of smoking? There is no scientific evidence that these products are leading into reduction of smoking anywhere in the world. They simply are saying this is a technovation meeting whereby this public health issue, nicotine delivery, is to now be, nicotine should be delivered with a more technologically advanced products, which is not going to take away the harms of these products. But I also want to inform my colleagues also that this is not the first time that the tobacco industry is going to come up with quote and unquote new products or new things. We witnessed this about 2 decades ago when the tobacco companies were running around the world saying the solution to smoking problem is to have, again, less harmful products, but then they were called low tar, lights, and all sorts of names as at that point, until scientists came out to say that, look, in fact, some of those products were making people to smoke more than, more sticks than they used to smoke. There is nothing to show that these products are going to bring reduction of smoking on our continent. Number two is that we have seen a system whereby young adults that originally are healthy use some of these products and then graduate into smoking. What a friend of mine says, and I'll use it here, is that if Philip Morris is interested in making people quit smoking, what they need to do is to stop producing and marketing tobacco products all around the world. And so I'll come back to my continent, Africa. Africa has always been the continent that the tobacco industry wants to conquer, because a lot of countries are having very tight tobacco control laws. Our laws did not recognize some of these products as at the time they were made, just like South Africa. Same thing happened in Nigeria. And the tobacco companies are looking for ways to ensure that these products are so promoted on our continent and that our kids and our children takes to some of those products. We do not have the health infrastructure to support the health damages that tobacco and these products will cause on our continent. Africa is a poor continent, and we need our resources for development and not to promote products that will harm our youths and our people. Lastly, they are also doing some of these meetings with journalists because a lot of African countries who also want to regulate these products want to put head taxes on these products. It is part of their debates to get governments to separate these products from the root normal tobacco products so that they can evade taxes on those products. So my challenge to journalists around the world is that this is not only an attack on Africa, it is an attack of public health globally. Africa is the focus as of today, but whatever information that they are pushing out, we should know that what is behind this industry organizing some of these meetings is for them to be able to recruit our healthy young generation into smoking so that they can continue to make profits and more profits. Thank you very much. I think I'm almost on my time. Back to you, Shoba.
Thank you very much, Bode. Thank you for articulating the lies and deception of the tobacco industry so well. And you are right, it is not only that it is the health of Africans which is at stake, it is a global phenomenon. And that is what the industry is trying to do. I now welcome our dear friend, mentor, and international lawyer, Daniel Dorado Torres. He is the Tobacco Campaign Director at Corporate Accountability. Over to you, Daniel.
Thank you so much, Shoba, and hi, everyone. I'm going to present some slides, so I really appreciate Bobby, if you please can put it. And thank you so much, Bode. Also great to have you here in this dialogue. And let me build from how do you wrap up your insights. Definitely what the tobacco industry is doing, what Philip Morris International is currently doing, and the most recent example acknowledging that this is not only attempt, this is one of the several strategies they are doing all over the world to basically position the rebranding strategy. That's how I will want to frame my whole insights. And that rebranding is mostly connected to what Bode just finalizes. In that rebranding strategy, they continue, and there is no proof that this transformation strategy that they feel or seem to be very proud of be positioning through media and everywhere is just another demonstration on their attacks to public health through several layers. And that's the intention of my insights. I will want to share several examples that try to see and that you all can see with concrete cases how this transformation strategy, if it is one transformation strategy, is operating globally, and how this transformation strategy that I wanted to start calling to how we are seeing and how it is operating in reality is just a rebranding strategy to what they have been doing decades and decades ago. And if we can go to the next slide, Bobby, please. Let me start with these three images. These images came from back in the 90s and basically is a concrete demonstration on how the tobacco industry keeps using the same messages with different actors. Here, the main audience were the doctors, physicians, in order to promote and position a messages that smoking was safe and that there was no any risk on consuming this product or combustible cigarettes, as we call it a little bit technically, because they are playing with those technicisms. No, now they are calling new products. That's how they present it to public officials, to journalists, and in that framing of new products, they are saying that they are low risk. And well, here was the same back in the 90s. They were presenting and also using images of doctors to saying that if doctors are smoking, why the population globally should not be consuming those products. If we can go to the next slide, please. And here we can start making the comparison, no? Philip Morris International particularly announced it back in 2018, a little bit earlier, that they were going to stop their cigarette business and make a complete transition to what they are calling new products. What we are currently seeing, and we were able to monitor and track Philip Morris International recent stakeholders meeting. Their major brand continue being Marlboro. Marlboro is a brand that they use to sell cigarettes, and cigarettes continue being the main financial muscle of all this supposedly transformation strategy. This was announced in previous years ago. They continue making and profiting for selling majoritarily combustible cigarettes. And well, they are presenting these products such as e-cigarettes, heat-not-burn products, nicotine pouches, and other devices that at the end, and let me be very vocal on this issue, what this supposedly transformation strategy seems to be is that they are trying to keep engaging new consumers. And let me move to the next slide to start position why we are making this affirmation. These are some pictures from a music festival in Latin America, concretely in my home country, Colombia. This is one of the major music festivals in Latin America, where Philip Morris International have one of its subsidiaries. Back in 2017, Colombia was one of the pilot countries where Philip Morris International launched their heat-not-burn product, IQOS. And well, it comes with this affirmation that they were trying to transition to, well, stop selling cigarettes and start promoting these devices. But these pictures, I feel that speaks for themselves. These are some promotional activities of combustible cigarettes, particularly the Marlboro brand, outside of the venue of where the festival is taking place. These pictures concretely are from this year's festival, but this festival takes place every year, and since 2017, where the product ICOS was launched, several promotional strategies such as these ones, where minors are not supposedly to go inside the venue. This year was the first time that they were creating some special zones for minors where, well, non-cigarette tobacco products, alcoholic products were able to sold, but outside the venue where minors could circulate, well, these promotional activities are taking place. So here is one more time the question: if they are positioning a transformation strategy such as they are doing in Africa and in other continents, why they continue doing this? If we can move to the next slide, and I'm almost concluding my highlights. So here is another concrete example of what is currently happening with other of those products they are actively trying to position. Here we are making the comparison back in 1994, where the 7 CEOs of the major tobacco brands in United States sold upon the US Congress that cigarettes do not cause harm. I feel that, again, if they have been able to soar until Congress, and this has not only happened in the United States, this is happening in other places, and now they are saying, and evidence right now, for example, this WHO report that Bobby kindly shared on the chat box, there are right now some elements that demonstrate that, for example, e-cigarettes and other tobacco of other of these variety of emerging tobacco products cause harm to health. So yeah, seems that lies continue now with these nicotine pouches. So let's see what will continue, and if they can continue maintaining this life for more time. If we can move to the next slide, please, Bobby. So, well, not everything seems to be as as dark as as I feel we are trying to present concrete examples of what is currently happening. Here we have the Global Tobacco Treaty, or the Framework Convention or the Framework Convention Tobacco Control, which this year is commemorating 20 years of its existence. The tobacco industry as a whole seems in this international public health treaty a threat to the core of their business. So one of the conclusions that the tobacco control community, particularly at corporate accountability, we are seeing is that the tobacco industry keeps making attempts to discredit and put a lot of pressure to this international treaty, because it allows governments, as Bode was presented, to implement measures that save lives, not only tobacco taxes, also health warning packages, also conflict of interest provisions, also liability, the use of liability provisions at the national level to hold the tobacco industry accountable, and many other measures that this treaty brings. And also, let me be also very vocal about this. The Global Tobacco Treaty itself makes an approach to harm reduction, and the approach to harm reduction is being built in the implementation of the policies and measures that the treaty has itself. So the industry is scared that there exists an international framework that will allow definitely to be able to approach to a scientific-based harm reduction approach that will redund into reducing the prevalence of tobacco consumption and, of course, will affect directly their business. Can we go to probably I feel the final slide, Bobby, please? So yeah, all of this to say, the attempts of the tobacco industry to discredit, misinform are out there. Definitely, let me take advantage that knowing that the majority of the audience that is joined today is are journalists. The responsibility in terms of counteracting and positioning arguments that are in line with the right to health, in terms of the human rights speech, in terms of making the right connections to a scientific-based treaty, such as the Framework Convention on Tobacco Control, is fundamental. And that's what the industry is trying to do. They take advantage of any scenario. Now, well, technological summits are everywhere, and definitely they will continue doing this. But there are ways. This last image that is here is the campaign that Corporate Accountability with other global tobacco control allies, some of them conveners of this webinar, are leading in terms of making a call to the Framework Convention tobacco control parties to move forward the liability provision of this international treaty in order to many others to recoup health sanitary costs, identify ways to reclaim the damage that the tobacco industry caused to environment, but other many abuses that historically the tobacco industry has been causing. So yeah, if anyone is interested in learning more on this petition, I will be more than happy to continue the conversation here or to follow up later. And well, thanks for creating this space, Shova and Bobby. I'm more than happy to continue the conversation. Thank you.
Thank you, Daniel. Thank you for pointing out the misconducts of the industry. And we will have you again for the question during the question and answer session, because there's a lot of questions coming up already. Our next speaker is Dr. Tara Singh Baum, Board Director, Asia Pacific Cities Alliance for Tobacco Control. Thank you, sir, for finding time to be with us here today, despite your hectic schedule at the WCTC 25, which is taking place in Dublin right now. Over to you.
Thank you, Shobha and Bobby, for organizing this wonderful session at a right time. I think there are a couple of things that I don't have any slide, but I would like to just the highlights a couple of things here. I fully agree with the previous speakers. They comprehensively highlighted the industry tactics and why they do this all. I have a bit of different perspective now. My different perspectives, one is the, like Shobha mentioned, misconduct of the tobacco industry. Fully agree. And what about the misconduct of the governments? What about the the misconduct of the community, the misconduct of ourselves? I think we need to really evaluate in that part as well. The tobacco industry interference and influence comes later. The first thing is we need to look at our framework, our strategy, our governments, the activities and program, all those things. In this case, I would like to say one key thing. And also there is some discussion here in Dublin around concerns. Are we doing enough? Or are we doing enough with the existing strategy? For example, we say tobacco control. That is our goal. Or what is our goal? We need to redefine. Even the WHO FCTC, there are many that are confusing. Of course, it's a really great treaty, the first treaty in a public health, and it's a legally binding. But I think it's a time to review the FCTC framework as well. It's a time to think beyond the FCTCs and time to set the targets or clear the roadmap to end tobacco and nicotine. I think the time to set up really clear goals, tobacco and nicotine free, generation. or something. We have to come up with a very clear the vision for that. I think that there are a couple of points that we need to do. The first thing is we need to really ensure the government's the commitments. It's not only the Ministry of Health commitment, but whole of government approach is very, very critical. To make I think the first thing we need to do is we need to make the governments accountable. I think that's the key point we need to really highlight. It's not, and then we have to think about the tobacco industry. If governments are not accountable, then of course industry always there. So we talk about the misconduct of the tobacco industry. Definitely we have to talk and prevent, but at the same time we have to ensure that governments are there to really prevent the industry influence in policy making and implementation. And governments should not take any advantage or any action or any things from the tobacco companies or the nicotine producer. So the first thing is the government's accountability is key. The second part is the societal accountability. The whole of societal approach is also very critical. So how can we make sure that the society also accountable? That includes civil society, that includes any of the professional group or the community-based organization like any other, the health group or non-health groups. So we should have something that how can we ensure that the communities are also accountable. And the third part is of course, when I say the accountability, it needs to be legally binded. So every government, the government must ensure that there is a comprehensive the policies to completely ban the tobacco industry interference and their influence and engagement in any public policy making and implementation part. That is Article 5.3 of the WHO FCTC. It needs to be ensured to all across the sector. That includes not only the governments, but also the non-government sector. So which is really great. I think that in our webinar also that we see when we register, thanks Bobby and Soba to putting that also the provision, whether we have any engagement with the industry or not. So declaring out the something like conflict of interest. So this sort of things needs to be built on in everywhere. And again, back to the first point I would like to also highlight I think it's a time to review our strategy, review the goals, and review our the programs. So in that case, then only we can denormalize tobacco and nicotine products. Then we can completely prevent the industry and move forward toward the end game of tobacco and nicotine products. So something that I would like to highlight here. But it's the governments around the world, they are doing really great. And one of the good examples that we have recently from Cambodia, even the Cambodia, they are doing really good in tobacco control, but they need to do more. One of the highlights from Cambodia is the Cambodian government ban any type of investment in e-cigarette or vape, the product. I think that is something one step, toward moving the tobacco or nicotine products. So similar, I think the approach needs to be done in other countries. Again, it requires a lot of the support from the different community. Especially here, I would like to highlight the media, the support. So media, the role is not only to publish the policies, the news article and all things. I think the media it's played a bigger role to really highlight the need of a comprehensive the tobacco elimination program. I would say that tobacco is not a control program, elimination program, and the media's role also very critical to engage the policymakers. The media role is really critical to ensure that the policymakers get the right things at the right times. So it's sometimes it's really hard for the civil society and community-based organization like us to really approach to get the for example, like meetings or convey our message to the policymaker. But in the media, they can have the access to the policymaker at the highest levels to ensure that the policymaker they get the right message about the tobacco control prevention and elimination program. So something that is critical, and it's happening in many countries. We need more and more support from the from the media, the friends and colleagues. One good example is like I would say that always I appreciate the media engagement in Nepal. I think some of our friends there in this webinar, so they have made a really great progress. Not only that, as I mentioned, to publish the news articles, that's the regular thing, but it's beyond the news articles. The media in Nepal, they influence the policymakers. They did the one-to-one meeting. They and try to get the whole of governments, the support for any policy move in Nepal. So as a result, recently the Nepal had, they adopted the 100% pictorial health warning on the tobacco packs. So it's something. That is the critical, the part of the support from the media and many other civil society organizations. So I think in conclusion, again, the 3 points I would like to highlight here. When we talk about the industry accountability, the first we need to talk about the government's accountability, and then the industry accountability and the role of society accountability. I think we need to really try to build the such type of advocacies and the engagements with the different groups to ensure that everyone is accountable. Last but not the least, I think it's a time to review the FCTC framework and our strategy and approaches to end the tobacco and nicotine products. I think that I stop here. Thank you. Thank you, Suba. Over to you.
Thank you very much, Dr. Baum. And thanks for pointing out towards the accountability factor, accountability of government, civil society, media, all of us as a whole, and also the role of media. And I would just like to add one more thing there, that media has to be careful and not play into the hands of the industry, as we have seen is happening at times. And Dr. Baum, you spoke about Nepal media, and we are fortunate to have with us some of them here in the session. And let us listen to the lived experiences of some of our journalist friends. So I would request Kalpana Acharya, Editor-in-Chief of Health TV Online Nepal and host of Health First podcast, to please share her insights on what it means to be a strong advocate of tobacco control. Kalpana is former president of Nepal Health Journalists Forum and also on the board of Asia Pacific Media Alliance for Health and Development, that is APCAT Media. Over to you, Kalpana.
Thank you, Subha Madam. Thank you so much for this wonderful opportunity. Thank you so much for Tara sir for appreciating our work, what we are doing in Nepal. Thank you so much. Actually, in Nepal's tobacco control program, I must say media played a very crucial role. Media is a key partner in tobacco control, not just a communicator, not just a messenger, as earlier Dr. Tara said. Yes, tobacco industry's interference is everywhere, we know that. In Nepal also, industries interference are there in the name of CSR, in the name of sponsorship, in the name of donation. There are so much interference in Nepal also, but Nepali media, we expose them every time. We all know that Nepal's biggest tobacco company industry is Sure Nepal, and this company having 80%, almost 80% market coverage. This company always tries to influence high-level officials, policymakers in the name of sponsorship, CSR, and the name of donation. Sometimes they influence too, these policymakers, but we expose them and return back from their decision. happened many times in Nepal, as Dr. Tara said earlier. Another thing is in Nepal, media has consistently highlighted the damage of tobacco use, raised awareness about the laws and health impacts too. I must say, and I want to share one example. This is the prominent, it may be prominent example. When the Suri Nepal tried to sponsor literature festival, this incident is recently incident where top level bureaucrats, political figures were the guests. And we quickly exposed this incident, this program, and it creates public pressure, and Suri Nepal withdraw sponsorship. Another prominent example I just want to share here. I don't know I have to say his name or not, but I will share here. Professor Dr. Bhagan Koirala, this incident is 2 years back, chair of Nepal Medical Council and public health advocate. He is the public health advocate. He was ready to receive donation from the Suri Nepal tobacco industry, but we Nepali media exposed him, and later he denied to receive that donation and money. So I just want to share here, in Nepal, Nepali media is not just a communicator. We are acting as an advocate strongly in tobacco control program. In short, I can say Nepali media has helped shift the narrative from seeing tobacco as a commercial product to recognizing it as a deadly threat and the industry as a barrier to public health. So in my sharing, I have to stop here. Thank you, Sobha, for this wonderful opportunity. Thank you.
Thank you, Kalpana. Thank you for sharing your own experiences and how, and we have seen the effect of this media, the role of media in making Nepal a great country as far as tobacco control laws are concerned. Thank you very much for that, Kalpana. We also have with us Ram Prasad Newpain, editor of Nepali Health and former president of Nepal Health Journalists Forum. Ram, you have written your comments there. Would you like to speak right now and share your thoughts? You can speak in Nepalese if you want to, and we would ask Kalpana ji to translate it for us, or we will read your comment, but we would definitely like to hear your voice here. Yes?
Hello.
Yes.
Thank you, Subha.
Yes.
म नेपाली भाषामा बोल्न चाहन्छु। अघि
Yes.
कल्पनाजीले धेरै कुराहरू भनिसक्नु भएको छ। मैले च्याटबाट पनि नेपालको मिडियाहरूले गरेको कामको बारेमा थोरै जानकारी मैले दिएको छु। डाक्टर तारा सिंह बमले अघि नेपालको मिडियाहरूले गरेको कामको विषयमा पनि धेरै कुराहरू भनिसक्नु भएको छ। कल्पनाजीले पनि भनिसक्नु भएको छ। हो, हामीले नेपालमा धेरै राम्रो सुर्ती नियन्त्रण सम्बन्धी कानुन बनायो सरकारले, तर त्यसको कार्यान्वयन गर्ने बेलामा चाहिँ एकदमै गाह्रो सिचुएसन, कानुनको कार्यान्वयन गर्न एकदमै गाह्रो सिचुएसन छ र त्यसलाई चाहिँ नि सुल्झाउनको लागि, त्यो सिचुएसनलाई अलिकति मत्थर पार्नको लागि नेपाली मिडियाहरूले एकदमै राम्रो रोल खेलेको छ। मलाई लाग्छ दक्षिण एसियामै नेपालको मिडियाहरूले, अरू देशको त मलाई थाहा छैन, तर दक्षिण एसिया अरू महादेशको त मलाई थाहा छैन, तर
Okay, you can read. I will read out the comments what he has said in English, and Ramji said that in Nepal the tobacco industry influences government officials. For example, the Ministry of Industry recently wrote a letter to the Ministry of Health asking them not to implement the law. It influences social leaders. For example, Surya Nepal announced that it would donate to the hospital being built by Nepal's top and popular doctor, Bhagwan Koirala. Kalpana had also mentioned that. Similarly, it has been directly or indirectly sponsoring events of public interest, such as literary programs and sports. The government itself honors the tobacco industry on the red carpet, calling it an industry that pays taxes annually. This has created a bit of confusion among the general public. But the Nepali media is aware of this issue and has been constantly warning about the interference of the tobacco industry. Thank you, Ramji. We now open for comments and questions from the audience. Solomon Foley wants to know, why is it so difficult for Africa to ban or stop the tobacco industry infiltrating our markets, especially when the evidences are glaring about their products? Bode, would you like to answer that?
Yes. Well, there have been questions about whether to ban or to regulate. Why some of us who want an end game of total eradication of tobacco products, we must also acknowledge the fact that the Framework Convention on Tobacco Control, particularly the Empower provisions, have been working in countries around the world to reduce smoking. What we have not seen clearly is the political will in quite a number of African countries to enforce clear provisions of the law, and most importantly, as articulated this afternoon, to separate the role of government from the commercial interest of tobacco industry by enforcing Article 5.3 that is to prohibit the tobacco industry from influencing our policies. And again, that takes also to what is called the emerging products that we've seen that the tobacco industry is again using to have a foothold on our continent. That because we do now have sufficient evidence to prove that these products are actually less harmful, that African countries can move to ban those countries from our communities. We'll continue to mount pressure. We'll continue to have conversations like this. And we believe that the media also can help us in amplifying the need for government to side with public health on our continent. Thank you.
Okay, there is another question for you from Adewala Olovoporuku from Lagos Traffic Radio. And Adewala wants to know, where are we with the MOU that was signed with the Film Censor Board on the ban of smoking in movies and musical videos?
Oh, okay. Thanks very much. I believe you are referring to the regulation that prohibits smoking in movies and skits and videos in Nigeria. That's a law. Interestingly, the Director General of the Nigerian Movies and Censors Board should be making his presentation about the updates on that regulation currently in Dublin. We believe they have made the necessary groundwork, and according to him, enforcement has started. I could link him up if you can chat me up or any of our team in Kappa, so that he can also come on your stations to provide some of the details of what they are doing with the stakeholders in the movies industry when he's back from Dublin.
Thank you. There is a question from Rita Vidyadana, a very senior journalist from Indonesia. And she would like all the panelists to please answer and satisfy her question. Rita says, in Indonesia, PMI has been supporting arts and cultural as well as sports and youth activities as disguise to market and to lure young users who are enthusiastic to get their support. While at the same time, the government and activists have no power to stop PMI from doing so. Lack of corporate accountability. The media in Indonesia, like in other low and middle income countries, are struggling to obtain revenues. Some of publication, print and broadcast media, as well as social media, reluctantly accept PMI advertisements as acts of survivals. Please share your experience. What should the media do? Daniel, would you like to answer? The question is for all the panelists. Boarded?
Well, okay. Let me say that what we have done, let's say in Nigeria, where I'm based, for instance, is to have a law that prohibits the tobacco companies from sponsorship, advertisement, and promotion. A lot of our national laws were done 10, 20 years ago, and some of them need to be revised to ensure that all the loopholes that were there when those laws were initially made are completely blocked now. Again, it's also that when those laws are there, people must be able to use the instrumentality of the law to bring them to justice. For instance, we begin to have conversation now about suing the tobacco companies when they, flout the laws. These are some considerations apart from calling them out in the media. So in Nigeria, it's no longer about whether the media can take those adverts or not. It's because the law actually prohibits those adverts.
Thank you. Maya Joshi wants to says that tobacco industry reaches media through PR agencies or directly also. They have other businesses like hotel and they give media advertisements, so have influence. They fund political parties at times. Any suggestions to fight tobacco industry within media to report the right things? Like how can any suggestions for media to ensure that media reports the right things and not gets carried away by the industry tactics? Dr. Baum, would you like to?
Thank you. I think again, when we talk about the industry, I have a bit different opinion always. Different opinion in the sense like it's not. I don't mean like we should not stop industry doing this one, but how to stop and who is responsible to do this is again governments. We need the strong government's commitments and action. And strong action in not only talk action in terms of the policies, the law, the regulation that should completely ban any type of tobacco industry engagement in any area, whether in CSR or anywhere. It should be completely stopped. So those things who can do is only the government. So the first thing, we have to make the governments accountable. So therefore, my request to all the media here is before when we talk, we see, industries, like for example, in Indonesia, industry, they are doing many of the things. They are funding the education, they are funding the medical, they are funding the sports everywhere. Why it is happening? Because there is no such a strong regulation in place. Why is regulation is not there? There might be the issue of either the policymaker, they are not aware about the tobacco, the damage, or there is a corruption. And some of the speaker also mentioned the political donation, the private donation. It's all money game. So either the governments are very corrupted, that's why there is the policy are not in place, or the governments, the people, the policymaker, they don't know about the danger of tobacco. So therefore, I think that in most of the case, because of the two reasons, I think that is something we need to consider. So and again, we need to make the governments accountable first. Then only we can have some strong tools to really stop the industry doing all the wrong thing. Yeah. Over to you.
Daniel, would you like to add?
Yes, Shoa. I'm sorry, I was having internet problems, so that's why I couldn't reply to the previous question. So I will try to merge both because they are very connected.
Yes.
So, yeah, very in line with what both they share. Let me share a concrete example and also from Latin America. In Colombia, back in around 1991, all the Colombian soccer tournament was sponsored by a tobacco company brand. And definitely, when the tobacco control law enters into force, it bans the sponsorship of sports events and other major events with this. there was a crisis because you can imagine that soccer moves many countries, no? In several ways, economies, there are definitely many things that are structured around soccer. And at the end, the industry was making a case that if they do not sponsor the soccer tournament, soccer will disappear in Colombia. As they also use these arguments when they say, well, if you keep me imposing taxes, if you keep me putting strong measures, I will leave your country and there will be a lot of unemployment. Well, applying the law, and this brings my connection to what Dr. Tam was bringing. Yeah, the Colombian government was obliged to enforce the law, and basically there was no way that the Colombian soccer tournament could continue receiving funds from the tobacco industry, and they stopped sponsor the soccer tournament. Nowadays, the Colombian soccer tournament continue, and this brings, for those countries that have this implementation, definitely accountability is an issue. But let me connect it with the media and the journalists and how you all can be playing a role. Yes, there are many ways. And there are also examples that, well, newspapers, and other journalists are not aware, and it is not the fault of not knowing that exists an international treaty regarding tobacco control, that there exist some prohibitions of the national tobacco control law, because in many countries, even today, most of the tobacco control measures are very connected with health warnings, but just come to another example, the point of sale, when you see those cigarette products being advertised and promoting really close to candies and all of that. Not everyone is aware that this is prohibited, and there should be like a double way education in terms that, well, coming back to the accountability, government should be more vocal about that this exists. But where government is not being accountable, there is the role of civil society to, well, to be very vocal about this. And there has been successful cases in Latin America, for example, where also specialized journals in medical health that were not aware of the specific law, civil society advocates have framed, and they have put down the advertising also, uh, including some of the provisions of the Framework Convention on Tobacco Control, the specific Ecuadorian tobacco control law. For example, this is a recent case in Ecuador. And yeah, I feel that could be one of the ways, and also, well, spaces like this, no? I really appreciate the way CNS approach to collectively bring us together to share, and let 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 me take this opportunity to say that we are also a resource for you, no? So when tobacco industry approaches, well, I feel that the other side of the story should be telling, no? And definitely there should be opportunity for tobacco control advocates to be able to present and say, well, the tobacco industry saying this, any opinions on what you are doing, and this could also balance, because I know that there are payment issues that probably could go beyond what you can really do, but giving the opportunity to others to say the other side of the story, that is I feel, a proactive way to be able to counteract the tobacco industry interference tactics through media.
Thank you. Ata Ede from Daily Asset newspaper Nigeria wants to know, how do the media contribute to the deceptiveness of the tobacco industry? I'm sure all the panelists would like to answer this. Yes, anybody could begin. Media?
Well,
yes.
I think when the media refuse to question some of the information that the tobacco industry put at them, they indirectly become complicit in what the tobacco industry is dishing out. When the media abandon its role as the watchdog of the society, they become complicit in what we're talking about. some of us believe that it's the responsibility of the media to help dig into how the industry, and frankly, quite a number of the media globally have done that, but we need more at this critical period of our public health conversation globally. So we think that the media is more charged to be able to help to defend public health and not side with industries that we know are killing our people.
Right.
Yeah.
Very right. Any other panelists would like to add something to it? Although you have been right on the dot mark.
I think they just to
Yes.
add, when we see now the media, it's a very different the media that we talked when we were 2003, for example, 2010, and now. So one of the key things that that we would request media to verify the content or any information. There are three type of information. One is the scientific evidence. I think if anyone sharing any information, any scientific evidence, whether it comes from any public health group or any non-public health group, a strong request is that needs to be verified, and it can be verified nowadays. It's we are on the digital the world, so it's easy. The second is the legal framework. There should be a legal evidence as well. The industry, they are trying to use manipulate or different ways. So before writing anything, the media needs to also verify the legal the support, and then the on the ground reality. I think that is the key part. We all are living in a society. We know what is happening on the ground. So that will be a real time story. I think the ground reality needs to be published, emphasized, and that brings some more attention of the policymakers and the public. So yeah.
Thank you. And also, when you're very right, Dr. Baum, when you say that you verify and see what does the scientific evidence show, because the tobacco industry also promotes, or rather it helps in a lot of, it publishes its own research papers also, and it pays scientists. They are not scientists, but the so-called scientists, they publish their own results, and which are contrary to what the actual reality is. So you are very right in saying that we should verify the source of that information. That is very important. And whether that research is being funded by any cigarette company or tobacco company also. And there is nothing which is less harmful. I believe that this is what PMI and all are touting right now, that they are trying to have a smokeless society, and they are giving products which are less harmful. That I think that has to be rebutted and not taken for granted. Daniel, would you like to say something?
Yes, really briefly, because while both and Dr. Tam were speaking, I recall that, for example, the New York Times has a specific policy of not receiving any money directly or indirectly in their editorial content, for example. So there are good practices that journalists, media agencies, and everyone that in some way is committed that could take a step forward. No, this takes time. Of course, there are some media outlets that will require some type of yeah, the industry takes advantage of that, no? So, but this doesn't mean that particularly regarding these products that kill more than 8 million people a year, there could not be some issues that could be adopted in order to, through the stories that are going to be telling, do not misinform, and as Bode was saying, the media plays the role on advocating for public health measures, no, and also make the governments accountable so that they can implement what Dr. Tam has been able to position in terms that the majority of the responsibility, of course, is on governments on implementing the Framework Convention on Tobacco Control.
Thank you. Thank you. I think we have already overshot our time. So with this, we come to the close of this session. A very big thank you to our speakers for debunking many of the myths which are there, which have been rather touted by the tobacco industry, and how to counter them. And also, I'm grateful to our audience for being with us today. I'm sure all of us are convinced that we as media and civil society have to be very careful of the dubious tactics used by big tobacco to advance its own interests. Media should not become a pawn in the hands of tobacco industry. Rather, it must hold it to account and expose and debunk and counter the lies of the tobacco industry and advance public health based on science, not on junk science, which is being put forward by the tobacco industry. Ending tobacco use and holding tobacco industry legally and financially liable are critical cogs in the wheel if we have to deliver on the SDGs. Tobacco companies, including PMI, need to be held legally and financially liable for the harm they have been knowingly causing to human life and to our planet. Because the truth is that every tobacco-related disease and death is preventable. So I'm sure with keeping this in mind, all of us will be accountable, as Dr. Baum said. All of us are accountable for holding tobacco industry responsible for their misdeeds. Thank you very much.